So after great discussion about action membrane potential in the neurons, in the skeletal muscles, in the arteries, ventricles, myocytes, and in the sinoarterial and arterioventricular nodal cells, we are going to reading from the first step one, page number 30, 2021 edition, and from the BRS Physiology, page number 77. So stay with us. Cardiac action potential. In starting, we discuss about rest RMP. First of all, we discuss about RMP. Resting membrane potential is determined by conductance to the potassium, and approaches the potassium equilibrium potential. Inward current bring positive charge into the cell and depolarize to the membrane potential. Outward current take positive charge out of the cell and lead hyperpolarize the membrane potential. Role of sodium potassium adenosine triphosphate in simple sodium potassium ATPase pump to maintain ionic gradient across the cell membrane. Now we are going to discuss about ventricle arteries and Purkinje system having stable resting membrane potential of 19 millivolt, already discussed in greater detail. This value approach the potassium equilibrium potential. Action potentials are of long duration, especially in the Purkinje fibers, where at least 300 millisecond. And uh, action we know very well action potentials. Duration of arterial ventricular is a 200 millisecond, and in SA node and AV node is 100 millisecond. Next, we are going to discuss about phases of arterioventricular when arterioventricular action membrane potential from the first step 1, 2021 edition, page number 301. First of all, if we discuss about phases of the myocardial action potentials of the arteries and ventricle. Phase zero. Phase zero, rapid upstroke and depolarization. Voltage gated sodium channels are open. Phase one, initial repolarization phase. In activation of voltage gated sodium channels, voltage gated potassium channels begin to open. And in phase two, plateau phase, also called plateau phase, calcium influx through the voltage gated calcium channels balance potassium efflux. Calcium influx in triggers influx triggers calcium release from sarcoplasmic reticulum and myocytes contraction, excitations, contractions, coupling, like that. And phase 3, rapid repolarization, massive potassium efflux due to opening of potassium gated slow delay retinal potassium channels and closure of the voltage gated calcium channels. Next, phase number 4, resting potentials, high potassium permanently through potassium channels. And in contrast to skeletal muscle cells, what is the differentiating points between arteries and ventriculars and skeletal muscle cells? And cardiac muscles action potentials has a plateau due to calcium influx and potassium efflux. Cardiac muscles contraction requires calcium influx from extracellular fluid to induce calcium release from the sarcoplasmic reticulum. Calcium induced calcium release phenomena. Cardiac myocytes are electrically coupled to each other by a gap junction. This is an important point. And also occurs in all cardiac myocytes except for those in SA and AV node. This phases, okay. And we know phase 1 and phase 2 are absent in the SA and AV nodal action membrane potential. Okay, next, these phases also we are going to discuss from the BRS physiology. Here is phase 0. For example, from the BRS physiology, phase 0 is the upstroke of the action potential. Okay, is caused by the transitive increase in the sodium conductance. Okay, increase result in inward sodium current that depolarize the membrane. This is from Cvs physiology. Occur because, sorry, from phase. Yes, at the peak of the yes. Phase zero and phase one is this one. And at peak of the action potential, the membrane potentials approaches the sodium equilibrium potential. And phase zero is a brief period of initial repolarization. Initial repolarization caused by the outward current in part because of movement of potassium ions favored by the both chemical and electrical gradients out of the cells, and in part because of the decrease in sodium conductors. Phase 2 is a plateau phase, already discussed from the first stage. Step 1 is caused by the transient increase in calcium conductance, which result in inward calcium current, and by increase in the potassium conductance. During phase 2, outward and inward currents are approximately equal, so the membrane potential is stable at the plateau level. Phase 3 is repolarization. During phase 3, calcium conductance is decreased and potassium conductance increase, and therefore predominate. The high potassium conductance result in the large outward potassium current, and which hyperpolarize the membrane back towards the potassium equilibrium potential. Phase 4 is the resting membrane potential, is a period during which inward and outward current are equal and the membrane potentials approaches the equilibrium potassium equilibrium potential. After discuss about arterial symmetrical pressure, now we're going to discuss about sino-arterial node and AV nodal phases. Sino-arterial, first we discuss from the first step one. Also, pacemaker action potentials occur in the SA and AV node, and key difference from the ventricular and action potential. Phase zero. Phase zero, obstruct opening of the voltage gated calcium channels. Fast voltage gated sodium channels are permanently inactivated because of the less negative resulting potentials of these cells, result in a slow conduction velocity that is used by the AV node to prolong transmission from the arteries to ventricles. Phase 1 and phase 2 are absent. This is the MCQ. Phase 3, repolarization phase, inactivation of the calcium channels and in increase the activation of the potassium channels, increase potassium efflux. Phase 4, slow spontaneous diastolic depolarization due to funny current. Funny current channels responsible for slow mixed sodium potassium inward current, different from sodium influx in phase of the zero of ventricular action potentials, account for the atomicity of the SA and AV node. Slope of the phase 4 in the SA node determine heart rate. Um, Phase 4 in SA node. This is an important point. Also mention, please also write in notes, okay? Phase 4 in the SA node determines heart rate. Acetylcholine, adenosine decrease the rate of diastolic depolarization and decrease the heart rate, while catecholamines increase depolarization and increase heart rate. Sympathetic stimulation increase the chances that funny currents are open and increase the heart rate. Already discussed in greater detail. Okay. So next from the BRS physiology, if we discuss phase number, okay. Sinoarterial node is a normally pacemaker of the heart, has unstable resting potential, exhibit phase 4 depolarization or atomicity. AV node and the his Purkinje systems are latent pacemaker that may exhibit atomicity and override the SA node if it is suppressed. The intrinsic rate of the phase 4 depolarizations and the heart rate is faster in the SA node and slowest in the his Purkinje system. Phase 0 is the upstroke of the action potentials is caused by the increase in calcium conductance, increase caused by the inward calcium current that drive the membrane potential outward the calcium equilibrium potential. Next, ionic balance for phase 0 in the SA node is different from that in the ventricles, arteries, and Purkinje fibers, where it is the result of the inward sodium current. Phase 3 is the repolarization is caused by the increase in the potassium conductors. This increase result in outward potassium current that cause repolarization of the membrane potential. Phase 4 is a slow depolarization count for the pacemaker activity of the SA node. Atomicity is caused by the increase in sodium conductors, which result in inward sodium current. Funny channels. Funny channels is turned on by repolarization of the membrane potential during the rest preceding action potential. Phase 1 and phase 2 are absent in the SA node action potential. AV node upstroke of the action potential in AV node is the result of an inward calcium current as in SA node. Similar. Okay. Conduction velocity also we discuss reflect the time required, and fastest conduction in the Purkinje system, slowest in the AV node, already discussed. Okay, so this is all about cell membrane physiology. Thanks for your attention, for your listening. Lecture dismissed till tomorrow.